choice in Wisconsin.
According to the American Diabetes Association, 1 in 3 American adults have what's known as pre-diabetes, making them more susceptible to the disease. Here to talk a little bit about the importance of getting checked this morning. Joining us from Gunderson Health System is Barb Kaufmann. Barb, thanks for waking up with us this morning.
Thank you.
Now, we're talking about Diabetes Alert Day, and this is something that's a national movement, and it's something that's already happened in March, but can you tell us a little bit about what is this push to get checked?
Well, I think that the incidence of diabetes is just increasing overall, and so it's just an awareness and just to remind people that it is important to be aware of the possible symptoms, and if you have a history or a family history of diabetes, to look into what your risk factors are, because many of the risk factors for diabetes are things that we can control. Many of them are things we can't, but the things that we can control, we want to start early and start working on them. As you said, the incidence of prediabetes is quite high, and so is the incidence of diabetes.
And obviously diabetes in itself is a disease, but it can lead to other even more serious diseases, right?
Certainly can. Diabetes can affect us throughout our bodies. It can affect your eye health, your kidneys, your nerves. It increases your risk for heart attack and stroke.
Now, what are some of the risk factors for contracting this type 2 diabetes?
Some of the main risk factors are certainly if you have a family history of diabetes, you're at a higher risk. Certain ethnic groups are at a higher risk. If you're a higher weight for height, you're at higher risk. Low activity, hypertension, abnormal cholesterol. For women who've had a history of gestational diabetes, they're at a higher risk, and age is a factor. As we age, our risk for diabetes increases as well, over 45.
And obviously important always to get screened for any disease early. What are some of the things that can help, I guess, with the treatment of diabetes with early detection?
Well, again, working on those risk factors that we can control, so even once you're diagnosed, working on just small changes in terms of weight, a modest weight loss can help decrease your risk or improve your outcome as far as diabetes in terms of decreasing possibly your need for some medications over time. Increasing activity is very important. Activity is almost like a medication all in itself. To help our body use the insulin better, so increasing activity if you have a low activity level. So some of those things are very easy to manage, improving your blood pressure, improving your cholesterol. All of those things help to decrease your risk.
A lot of good information. Unfortunately, Barb, we are out of time, but thank you for joining us this morning to detail the importance of getting checked for this prevalent disease.
Thank you.
And we'll head to break with